So, depending on upon the severity of COVID-19, in case it is quite severe or it's really going the wrong way, we advise, antivirals, and of course, potentially the need of an ICU and a ventilator. Remember, when a woman is pregnant, it's very important to try and save the woman's life. The fetal life or the baby's life is extremely important. But one has to remember that, we have to first save the mother, and we have to make sure that she's okay. Now, in the situation where one is on a ventilator, and unfortunately, the chances of survival for the mother look very slim, one can, as the family or the relatives decide on whether one has to perform an emergency, maybe in some cases a post-mortem cesarean section, to try and salvage the child. This, of course, is a very hard situation, very difficult situation, but in some cases, this has had to be done all across the world. Now, what the effects of antivirals and a ventilatory support is, usually in my experience, in some cases, antivirals as well as a ventilator can affect the continuation of pregnancy. In some cases, the baby might find it very hard, very difficult to survive, and in some cases, the baby gets through it just fine. When one usually has a ventilatory support, unfortunately, the uterus starts contracting, and the pregnancy will, in some cases, try to terminate itself. Now, during labor, when a woman comes in, there is a chance, and in many cases, this is what has happened, is that the woman comes in labor and is found to be COVID-19 positive. So, how do we manage this, and what should you expect in a situation like this? Usually, when the woman comes and she is COVID-19 positive, the doctors, staff will be wearing protective equipment. So, a woman has to be prepared to be in this scenario. There will, of course, she will have to wear a mask and, maintain hygiene. The surroundings will be fumigated, disinfectants will be applied, and really, this is a closed environment, and the delivery is conducted as quickly as possible. There is, of course, no compulsory need of a cesarean section. Even a vaginal or normal delivery should be fine. And it is not necessary that a child is affected with the virus. Most of the babies, in fact almost all till date, have turned out just fine. The long-term effects of the virus are yet to be known. But usually this infection passes away in a few weeks. Once the delivery is done, the pediatrician and the gynecologist will decide on the infectivity status of the mother and try and give the child feeds till the mother is okay. These feeds will be either through an external supply, not the mother's breast milk, but she can express the milk and the milk can be given to the child by the staff. Now, usually the mother is sent to a COVID-19 facility, and once she tests negative, she can go home or stay at home. This is, of course, to protect the child as well as relatives at home. Now, during the antenatal period, what are the precautions that one must take when visiting a doctor or a gynecologist so as not to contract COVID-19? Pregnancy is a very precious time, and a time, especially now, to be very careful on what you all are exposed to. Try to come in contact with as few people as possible. It might be just 2 or 3 helpers or relatives, your husband, and one should ideally visit a clinic where there are few patients in the waiting room. Try to come in at just the time when the doctor has asked for you. Wear a mask, sanitize your hands, make sure that the people around you are also wearing a mask, and try to stay at the hospital or the clinic as less a time as you can. Remember to ask the doctor all the questions or concerns that you have, and please notify if any relative or anyone you have come in contact with has suffered from any symptom of a viral infection.